Health Beat with Dr. Vanita Zahn.
Welcome. Yes, the vaccine has arrived, but yes, we still have to keep wearing masks. And now there's a push, or at least a strong recommendation, to double mask. What's up with that? Dr. Kevin Gallagher is the Chief Medical Informatics Officer at Hudson Headwaters Health Network, and he joins me now to explain. Good to see you, Dr. Gallagher.
Hi, good to see you, Dr. Zahn.
Thank you. So I've got my homemade cloth mask. I have the surgical. I have a cloth mask that also has a little pouch that I can put an extra, barrier in. I've got a KN95, and I've got the granddaddy of them all, an N95. Let's start by, let's rank them. What's the best?
So I think it depends on what you're trying to achieve. The N95, if you are a healthcare provider and providing direct patient care to someone known to have coronavirus or someone that could have coronavirus, the N95 has only allows certain particulate through that you can breathe. And the droplets, which is what spreads coronavirus, is impermeable to those masks. So that would be your best defense by wearing that.
Now, I know, and I'm hearing lately, I follow all the media, that there's a push for us to all wear the N95s because there's enough of them out there, supposedly now, not like it was back last March or April when ramping up of production was still going on. And they also make a better seal, correct?
They do. They make a better seal. If you're using some of the OSHA-approved N95s, those can still be difficult to get a hold of in large quantities. So we at our organization are really trying to make sure that people are trying to get the most shelf life out of when they're wearing those masks, because it's important for ongoing patient care. They are, because they don't allow as much particulate matter through, a little bit more difficult to breathe through, as you might imagine, because it's providing that extra layer of protection. Still wearing a general surgical mask or cloth mask will prevent one's droplets from entering the air and atmosphere around them. That type of mask, exactly, Dr. Zahn. Mm-hmm. So wearing that mask will help prevent some of the droplets from being able to be breathed. But the biggest part that it does is it prevents your own droplets from entering the environment around others.
Now, Dr. Gallagher, if this does what you just told me it does, why do I need to perhaps use this one and then double mask with this one? And that's something that I'm hearing, and I'm sure the viewers are hearing as well as we tune in to national media. We're also hearing it from the CDC. Why both?
Sometimes the integrity of the mask, because you've been wearing it a certain amount of time with moisture, is thought to not be as effective with containing some of the droplets. So that can help with that. There's varying evidence around whether or not that should be a firm recommendation. I think the biggest thing to remember as we're heading into this phase where some of the community has been vaccinated is that we still need to remain vigilant wearing masks despite having a certain portion of our population who's been vaccinated.
And that is why?
Well, for a variety of reasons. We know that approximately 2 weeks after you've received your second dose of either the Pfizer or the Moderna vaccine, that you've achieved the immunity that you should. What's still being studied, and I haven't seen any definitive literature out there, is whether or not having that immunity status prevents you from actually carrying the virus. So in other words, even though you may be immune to coronavirus because you've received the vaccine, we still don't know if that means that you could be a carrier of the coronavirus and could then spread that to others who haven't been vaccinated. So it's still really important at this point in time, based on the available evidence, to remain vigilant wearing masks, even if you've been vaccinated, until we have more information available in the medical community.
So let me just double back to the double masking. Is the double masking message coming out now because we are seeing the more highly transmissible, the more easily transmissible variants? And is that why we're hearing this conversation to double mask?
I'm actually not sure, Benita. The thought there might be that we are learning that some of the variants from the UK, and I believe some of the states in the Midwest, have had some confirmed Brazilian strains. There's some concern that these are a more virulent strain, meaning that they can be spread easier. And so, if something could be spread easier, providing more protection against those droplets would seem to make sense. Again, we're in a really interesting time in medicine and science where we're learning about new things before we have enough evidence to support what we're doing. And we're trying to do what makes the most sense to be protective.
A cloth homemade mask, and this one appears to, my friend did a good job. It's two pieces of cloth sewn together. This versus this. This one's going to give me more protection than this one?
They're probably roughly equivalent. I think the concern sometimes with the cloth ones is maintaining moisture content. The benefit to those is that you can wash them and reuse them over and over again. They're still recommended over wearing nothing at all, but they're pretty close to equivalent in terms of your ability to protect your own droplets from others.
And when I go out, if I'm exercising, and this past summer, we were out at the Cape and everybody was doing a good job of covering up, but I got to tell you, when I had this, after a while of covering down, it got wet. Does that mean it's no longer effective?
It's still effective, but once it becomes wet, the question becomes, how did it get wet? So if it's your own moisture, that's one thing. But certainly if you're in a healthcare environment, if that's somebody else's droplets that's causing the moisture, that's where the concern can come in. But there is some question as to whether or not it's still as good at retaining your droplets once it becomes damp.
Okay, and then
and it's uncomfortable to wear once it gets that wet. So your likelihood of being compliant with it will go down as well. Yeah,
and then early on we were instructed to put it on carefully, like this, to take it off that way, and not to touch the front because this is where the germs are. Still the warning?
Yes, that's still the way to do it. Again, you don't. The part you're touching on the front is where the droplets could come into contact, and so that's the part you wouldn't want to touch. And how many times can I reuse this? I've got one I leave on my desk. I put my makeup on. I put that one on so that I don't make this one covered with makeup. Can I use it repeatedly? A couple of days, into the studio, out of the studio, run to the market, back from the market? I mean, I see this. People are hanging them from the rear view mirrors in their cars. Sure. I think it varies. It depends on how much you're wearing it and how often you're wearing it and in what conditions you're wearing it. A lot of times you'll find with the basic surgical mask that you showed, if you've worn it enough, the inside of it starts to become pilly, almost like an old sweater. And usually you can start to notice that it's starting to lose some of its integrity. The actual material is starting to sort of decompensate. So I think once you've noticed that the interior of it is starting to wear down, it's probably time to get a new mask. And before I let you go, I just want to one more time. Do you think it's appropriate for us now to be double masking, particularly because of the new, more virulent, more easily transmissible strains of coronavirus? I think we need more information. I think we need to hear some more information from the CDC and some guidance there. It is, certainly a measure that seems to make sense, but whether or not it's something that we should be encouraging as official guidance, I think we still need some more information. How about you? You double masking, or are you going out with the N95 or the next step down, the KN95? Surgical mask in non-patient care areas. When I'm seeing a patient, whether they're well or symptomatic, we are all wearing N95s as well as eye protection. because we've seen such a growth in the prevalence of coronavirus over the past few months, that the number of people that could be asymptomatic grows as that prevalence grows. And so, finding out a couple of days later through contact tracing that you saw someone who felt well, who actually was pre-symptomatic with coronavirus, having that N95 on as somebody who takes care of patients, as well as eye protection, is your best bet as a healthcare provider.
And when you go to the market?
One of those.
With or without eye protection?
I usually wear glasses, so I have some eye protection on.
I see you took them off for us. Dr. Kevin Gallagher with Hudson Headwaters, thanks so very much. A really good lesson for us. And of course, we keep washing our hands and 6 feet. Eventually,
that's right.
You'll be in studio to do this. Take care. And thank you for joining us. We'll see you next time. Programs post every Monday and Thursday. Stay well.